The word doctor comes from the Latin word docere, which means to teach. That kind of relationship is ultimately what underpins our quality as a program, which is that the faculty really want to be with you, they really want to teach you, and they also would like to see you working alongside them for many years to come. My goal for residents who train in this program is to be lifelong learners, excellent clinicians who can practice anywhere in the country and possibly the world, and active and present participants in the lives of their families and of their communities. When you work for Bayhealth Emergency Medicine, we want you to be mindful. We want you to be intentional. We want you to be engaged. That's how you find fulfillment in what you do, by learning something new with every shift, with every conference, with every piece of feedback.
Bayhealth employs a phenomenally diverse group of people, and so I think Bayhealth does a really good job of representing the community that it serves.
Our faculty are dedicated completely to their patients, to their careers, but also to their families.
We don't overwork the residents in terms of the shift length or the amount of shifts that they're required, because the learning can occur in that time. And then there are wellness committees that provide residents kind of different outlets.
While we expect you to show up to shift, present, engaged, and ready to learn, we also want you to be able to take care of yourselves and your loved ones. I wish everybody who applied here could actually work a month here just to see how great of a place it is and how great our teachers are.
The teaching staff and the faculty here, I feel like the expectations have been exceeded. So overall, very excellent experience that I've had here, and I am staying on, so that should say something as well.
At Bayhealth, you are going to be a vital part of an extremely busy community healthcare organization that serves the people of Central and Southern Delaware.
The patient population, it's different at each hospital. So Dover and the Kent Hospital serves a large population, but it's different down in the Sussex area. And then we also send residents to the Route 9 freestanding emergency room / urgent care center, so that when they leave, they're experiencing 3 different emergency medicine environments.
You are going to learn from us how to take care of these patients through various mechanisms we have in our program. We have a weekly conference that is dedicated to learning how to pass the boards, how to truly become an independent clinician in practice. We have a very robust sim center here where you not only learn skills that are important to perform your job as an emergency clinician, but also where you learn about things like conflict management, leadership, team delegation, and how to emotionally manage your own personnel, not just the patients and their families.
We get about 12 to 16 shifts depending on what year resident you are, and each shift is very different, and each shift is a new experience.
We spend a lot of time learning from the faculty, and then we have sometimes residents who give lectures. So everything is given to you for you to succeed.
We have robust trauma rotation that takes place at a level 1 trauma center in the state. We have rotations in the pediatric emergency department in Nemours Hospital in Wilmington, and we have a challenging pediatric ICU rotation that our third-year residents go to and report that it really broadens their horizons about the care of acutely ill children.
Every attending, they all have different way of teaching, different way of working, but they are always eager to teach. They are always eager to help you.
Our attendings here understand that they're here to teach you first and foremost. What we owe you is our experience, our insights, and ourselves as a role model for you as a clinician going forward.
I had a very positive experience with all staff. Our mentors, our faculty has strongly encouraged us to interact with, nursing staff.
A lot of what I know today as a resident, I learned from the nurses, working with them. If you show that you're willing to learn, they will teach you. Some of these nurses have been doing this before I was born.
It's a very collegial atmosphere for everyone, not just the physicians, not just the APCs, like the whole department is involved in each other, which is great.
It's not just having colleagues or having attending physicians, but it's more like a family.
The residents have a great opportunity via feedback to help us evolve so that their learning experiences are improved upon so that they leave as very competent physicians.
If I were to do it again, I will choose Bayhealth. I'm comfortable with the amount of knowledge and the exposure that I have, and I'm confident that when I leave here, I'll be a great attending.
This program has taught me so many things, not about even medicine, but about myself, about communication. You know, it was a very wholesome teaching program.
There is a certain magic that comes with seeing a group this diverse, united by a common purpose, and that is to become excellent clinicians to serve their communities for the rest of their careers.